Hey everybody, welcome to our presentation today for Psychology Month 2025.
Many older adults with ADHD report persistent problems as well as new challenges. During menopause, there seems to be a lower tolerance for stress, so you get overwhelmed more easily. Noises, fabrics, tags on your clothes, the kinds of things that maybe you could ignore before, you can't ignore them now. Neuroinflammation is bad for brains and bad for our bodies, bad for our hearts, bad for everything. Many people have ADHD, about 3% of adults, and ADHD is also evident in older adults. And this is from a recent meta-analysis. So we know across the globe about 3% and maybe more have ADHD. We also know that ADHD, while it is usually diagnosed in childhood, it is a developmental condition, it appears to persist in older adults, though of course not all adults and older adults get treatment. Lots of people don't even know they have ADHD because they seem to be managing. But what happens when ADHD meets aging? It is an adjustment for everyone. So aging is not for the faint of heart, I can tell you. I'm not that old yet, and I'm already noticing it's like, whoa, there's some challenges. As a person who lives with ADHD, there's some extra complications. Many older adults with ADHD report persistent problems as well as new challenges. So things maybe that they always coped with, but there's some new things that come up. Time blindness is a big one. So being unable to relax, I think that can happen throughout the lifespan, but time blindness seems to be a bigger one. I hear people saying that they are losing track of time. They struggle to estimate how long time takes, and this seems to be a new problem or a worsening problem. People talk about difficulty controlling their thoughts. So this is tricky because it can look like anxiety. So they might go to their doctor and say, my thoughts are racing, I can't fall asleep. And the doctor might reasonably say, oh, I think you're anxious. Maybe the person's anxious, maybe not. Maybe it's ADHD. Difficulty resisting goal irrelevant distractions. So the word distraction should be the signal that it's probably not relevant to the goal. Um, but sometimes a distraction can still be purposeful. So for example, you might be at home and you decide you're going to do the laundry. Great. But then you go to your bedroom to collect the laundry basket and you get distracted because you see how dusty your bedroom is and you decide to dust your bedroom and you forget all about the laundry. So it isn't that dusting your bedroom wasn't a job that maybe needed to be done. It just wasn't what you were supposed to be doing at that time. Again, this is not a new problem for an adult with ADHD, but it might not be something that was so noticeable until they get older. So we were supposed to be doing laundry and now we're dusting the bedroom. We might have a hard time re-engaging with the laundry. It's like, oh, I just forgot I was supposed to be doing it and now I don't even want to do it. I'm just like, the thought of doing laundry now, makes me just totally bored and depressed. So the laundry never gets done. Older adults talk about challenges with motivation. And so they can be impulsive. One of the symptoms of ADHD is impulsive behavior. And if we have motivational impulsivity, it can translate to things like impulsive spending. So I'm suddenly really interested and excited and like researching and just all about getting a new car. And then I buy the new car. So behavioral impulsivity as well. And maybe I didn't need a new car. Emotional impulsivity, another pretty persistent problem with ADHD across the lifespan, but older adults might not have had this before. So they might be noticing they're having a harder time inhibiting their irritability or their anger. And this is coming out, say, with grandkids who are noisy and disruptive. And so there's a sensory overload that's happening that didn't happen to them when they had their own kids. Verbal impulsivity. So reduced inhibitory control is not unique to ADHD, like I said, but it's way worse in ADHD. So now we end up blurting out things that we should have kept in our inside voice. God help me, as I get older. And social challenges. If we're blurting out everything that comes into our mind, it's going to have a negative effect on our relationships. So these are the kind of things that an older adult might be noticing. As we age, there's some specific challenges for all women or those who have ovaries. So I'll say women in this talk, but I am alive to the different expression of gender in lots of different folks. But if you have ovaries, you're going to have some specific challenges. Perimenopause brings its own challenges whether or not you have ADHD. But if you have ADHD, it means you're going to have more brain fog. Your concentration is going to be poor, so your sustained attention will be poor, and your working memory will be poor. So your ability to hold something in your mind while you work with the information, maybe to do mental math, to figure out the change of a purchase. You might have trouble remembering recent conversations. So you might start to worry that your memory is poor, but actually it might be an attentional problem. But we'll get to that in a minute. Perimenopause means sleep is poor. Sleep is a chronic problem in a lot of people with ADHD throughout the lifespan. So if you have two things now affecting your sleep, you're in double trouble. Lots of people going through perimenopause have mood changes. So depression and anxiety are common, and the changes can be quite sudden and significant. So if you already have emotion regulation concerns because you have ADHD and you're in menopause, your mood can fall off a cliff quite suddenly, and it can be quite dramatic and kind of scary. People talk about emotion dysregulation. So if your mood's falling off the cliff and you have verbal impulsivity, emotional dysregulation, so emotional impulsivity, you can see how this is going to cause problems in relationships. During menopause, there seems to be a lower tolerance for stress, so you get overwhelmed more easily. Noises, fabrics, tags on your clothes, the kinds of things that maybe you could ignore before, you can't ignore them now. And a very, very common problem, and one that often brings people to my office thinking they have dementia, is that they can't find words. But in fact, this is a menopause symptom as well. So when ADHD meets menopause, we have some extra challenges. As I've said, there's an exacerbation of ADHD symptoms. This is also true early in life. What we know is once a woman is postmenopausal, so they've reached the date where they're suddenly out of perimenopause, though I'm not convinced that's a real thing, but you've had a year without a period. That's what we call that day is menopause. And then after that, you're postmenopause. The research tells me that those symptoms, the perimenopausal symptoms and the ones that were making your ADHD worse, those are supposed to remit a little bit. It doesn't happen for everybody. For lots of women, their symptoms return, their ADHD symptoms return to what they were before menopause, but not for everybody. Some people never quite get back to where they were, which is a bit frustrating. Sometimes people have new symptoms, like I've said. So worse attention, their moods are worse. And if they are taking medication, it is not as effective in perimenopause, and it may not be as effective in postmenopause, though it's going to work better than it did in perimenopause. It's a little bit tricky. But does ADHD increase our risk for dementia? You might be interested in this talk because there were some reports in the news that ADHD increased your risk for dementia. The research is not so clear cut, as it never is. What the media tells us and what actual research papers say are not usually the same. So I'm going to try and clear it up for you. But let's start with some definitions. What is ADHD anyway? Lots of people have an idea of what they think ADHD is, but I'll tell you what I think it is. I think it's a problem of attentional control. So the name is not very accurate, in my opinion. It isn't that we can't pay attention. We have a hard time regulating our attention and controlling where it goes. I can hyperfocus on very salient things, but I might have a lot of difficulty focusing on something that is less salient to me, less important. This can look like a memory problem. So if I'm not that interested in something and I'm not really paying good attention, I'm going to have a hard time remembering that later. It can also lead to difficulty remembering something that I think I did learn because my memory might be disorganized. And I'll talk about that in a moment. What I can tell you though, ADHD is a developmental condition, usually diagnosed in childhood, but not always. Other than the mostly temporary effects of perimenopause and menopause, it does not get worse over time. In fact, it fluctuates quite a bit over the course of the lifespan. And what we know is the functional impairment of ADHD, it depends a lot on the demands of the person's life. So if my life is pretty calm, my schedule's pretty organized, and I don't have a lot of competing demands, time boulders, as I call them in my coaching practice, my ADHD symptoms will be minimal. Things are going as they should. But with increasing demands, the wheels might come off, and that's when my ADHD really manifests itself. So this is true of most people with ADHD. It really depends on the life circumstances, how much of a problem they might be showing. So now let's think about if I have not been diagnosed with ADHD and I get older and I'm starting to have problems with my attention or my emotion control or my memory, I might think, I should go get assessed because I'm kind of worried. I think that's a great idea. There's some challenges, though, when we try to think about how to assess for ADHD in an older adult. It can be hard to get a good childhood history. The people who might give us that information might not be available, and most of the time, older adults don't have access to their school records, especially their elementary school records, which are the most helpful to me when I'm looking at someone's school records. So that can be hard for me to get. Everybody, including you folks, have what we call a recall bias. Our memories are flawed for our lives. We forget all sorts of important things and remember things that our siblings who were there at the time remember very differently. That's just how memory works. That doesn't mean your memory's poor. That's how memory works. But it can be hard for me to get a good history. And we actually don't know yet, because we haven't done enough research, what does ADHD actually look like in an older adult? I have my suspicions and my thoughts, but it'd be better if we had the data. So we're working on it. So let's think about what we also should consider if we're doing an assessment or you're going for an assessment for ADHD. Like diabetes, sleep apnea, pain, polypharmacy, which are lots of things, lots of medications, anxiety, depression, low self-esteem, there are many things that might be going on in an older adult's life that affects how they function. So if I'm trying to measure someone's attention through their behavioral interview, maybe doing cognitive testing, though I don't tend to do that very much, I have to also look at all these other things to know what is the contribution of a potential ADHD diagnosis. It's also important to know that if you've been living with ADHD all your life, undiagnosed, you've figured out how to handle it. And so you might have lots of strategies that you don't even realize you're doing that actually effectively hide your ADHD from me, which is okay. It means you're managing okay, but it can just make it harder for me to do a good interview and get my diagnosis clear. And as I've kind of suggested, the criteria of ADHD don't really match what we might see in an older adult, and they definitely don't match the life of an older adult. If you look at the criteria like can't sit still when they're supposed to, leaves a meeting when they're not supposed to, how does this match up in the life of a person who is retired? It can be difficult for me to take the symptoms and match them to a person's life in a meaningful way. So that's a failing of the symptom list. Doesn't mean we can't look at it. It just makes it harder. Now let's think about what is dementia. So if you recall, if you were paying close attention, ADHD is a developmental condition that doesn't get worse over time. Dementia, on the other hand, is a progressive condition with adult onset that gets worse over time. The most common type of dementia, and the one I'm going to focus on here, is Alzheimer's disease, or it's also called dementia of the Alzheimer's type. This particular type of dementia is a deficit of memory and coding. So memory is the primary deficit in Alzheimer's disease. As the disease progresses, there's other problems, communication difficulties, and eventually inability to function independently. But the first and most important thing that people notice is difficulty converting a short-term memory. So I'm having a conversation with you and I'm holding it in my working memory or my short-term memory. I'm not able to convert that into long-term memory. So I can't remember that conversation 10 minutes later once it's over. That's the first and primary deficit of Alzheimer's disease. This is especially true for semantic memory, which is the memory that involves words and stories. So you can repeat something to me 20 times, but I have a flat learning curve. I can't learn new information very easily at all. There's at the early stages I can, and even in the later stages, if it's really salient, like you hurt me and tell me, I might be able to remember it. But what I'll definitely remember is how I felt when I was around you. And so I might not remember what you told me, but I will remember that you hurt me and I don't like you. But long before someone is diagnosed with Alzheimer's dementia, when we really have a suspicion that that's what's happening to them, they're going to have more subtle problems, which we call mild cognitive impairment. So Alzheimer's disease is memory impairment plus one other significant cognitive functioning problem, and you can't function independently in the community. Mild cognitive impairment is exactly as it sounds. It doesn't affect your functional independence. You can live independently. It certainly doesn't, you won't meet criteria for dementia, but you got some problems. Memory particular might be a problem. If someone says, I think you have mild cognitive impairment, that doesn't mean you'll get dementia 100%. But for lots of people, if they have been accurately diagnosed with mild cognitive impairment, they will convert to dementia within 5 years. So that's important to know if that disease has been made. So now let's figure out what happens when we consider them together. ADHD and mild cognitive impairment, so that thing that happens long before someone gets dementia, they do share some similarities. In both conditions, it can be hard to sustain attention, especially if the task is kind of boring. So nobody wants to do their taxes. Somebody with ADHD or someone with mild cognitive impairment, they definitely don't want to do their taxes. Both conditions make it hard to sustain mental effort. So working on something that is hard thinking, people like me with ADHD, we have to work extra hard to stick with it. And we might use all kinds of strategies to actually get our work done. It's a real problem, but it's also a problem in mild cognitive impairment. Sometimes they show difficulty organizing and planning. So again, if you've been living with ADHD, you're going to have a bunch of strategies, probably, hopefully, in place. If you get diagnosed with mild cognitive impairment, you might not have needed these strategies before, so you're going to have more obvious difficulties with organizing yourself and planning your behavior. Forgetfulness. So remember I said earlier, people with ADHD, it can look like they have poor memory because they maybe weren't paying attention in the first place, or their memories were a little disorganized. In mild cognitive impairment, that might also be true, but it's more likely that it actually is forgetting because that's their problem. And in both conditions, there's sleep problems and mood problems. So you can see why there might be some confusion for, the average physician out there who's doing their best to try to help their patients understand what the patient comes in reporting and their concerns. So I'm going to get a little bit technical for a moment. Hang in there with me and just talk a little bit about the biology because that might help us understand the differences between what ADHD might be looking like versus dementia. So ADHD, if you have memory problems, it's because your attention is poor. In fact, the memory processes for someone with ADHD work fine if you test it under proper conditions. But what we also know is the brain of an adult with ADHD is a little bit smaller than it would be if they didn't have ADHD, which I gotta say is pretty annoying for me. The front part of the brain, the part of the brain that stops me from like saying things like I just did, that's the part that's smaller. We also know that the front part of the brain is not as connected to the rest of the brain as much as it should be if the person didn't have ADHD. So those are some of the brain differences that we know exist from imaging studies with adults, kids and adults with ADHD. Alzheimer's disease. The memory deficit is an actual memory deficit. It's a problem with storing and it's a problem with encoding. And so the part of their brain that's too small is their hippocampus. So there's two structures on either side of the brain, kind of around your ears. Its whole job is laying down memories and then retrieving those memories. And that's the part that gets damaged and eventually so damaged that you can't form new memories once you have Alzheimer's disease. The parietal lobe, which is here, there's just not enough blood flow. Not quite sure why that is, but that's something they have observed in Alzheimer's disease. So you can see at a biological level, these two things are pretty different. So while on the surface, they might look similar, at the brain level, they're not similar at all. Risks. So ADHD can lead to some risks in life. You have a higher chance of lots of things that are not good in terms of your behavior, like smoking, alcohol, substance use. You might not go as far in school because maybe you have a low frustration tolerance. Maybe you also have a learning disorder. Your relationships maybe aren't as good. Like I said, if you're blurting out everything that should be kept inside, it can harm your relationships. There's a lot of comorbidity with ADHD in terms of psychological problems, other problems. And so it's sort of an equal opportunity disorder, and all other disorders are possible, but some are quite common: social anxiety, substance use, and sometimes depressed mood, but definitely anxiety in general. I think largely because untreated ADHD leads to an anxious life. And I think untreated ADHD leads to a lot of criticism, which is where the depression can grow. And I will mention the last one, diabetes and obesity. This, I think, is largely due to some behavioral choices that impulsive people make. And so we don't totally understand why people with ADHD are more likely to get diabetes other than through their behavioral choices. I think that's the link, but I'm not a physician. We'll probably learn more later. So there's some risks associated with having ADHD. Doesn't mean all those things are going to happen, but there's some risks. We also know that if you didn't go as far in school, you have an increased risk of developing dementia. Education is good for brains. Stay in school, folks. Every year of learning, you literally have more brain. And so if you have higher education and you get dementia, it doesn't show as early. So there really is value in learning at any age. Dementia is also associated with metabolic conditions, poor sleep, as we talked about, increased risk of dementia if you have lots of head injuries, and substance use psychiatric disorder. So you can see there are some risk factors in folks who have dementia that increase your risk for dementia, but also if you have dementia, you have increased risk. So again, some similarities here, but not exactly the same. But what it means to me is if you have some of these kind of non-specific problems, any of these on the list that are concerning you, or any of the things that I said before around attention problems, memory problems, many roads lead to these problems. This is the point I'm trying to make. And so clinicians like me need to be aware of this. We need to be aware that lots of things could be happening that could cause a certain presentation that a patient like you might be reporting. And so we really need to do a proper assessment and really clarify what is going on here. Because if we misdiagnose you as having ADHD, we give you the wrong treatment. If we misdiagnose you of having mild cognitive impairment, we terrify you for no reason. So it's really important to us to get it right. One thing I know for sure that everybody benefits from is really thinking about inflammation. Neuroinflammation is bad for brains. I'm going to say that again. Neuroinflammation is bad for brains and bad for our bodies, bad for our hearts, bad for everything. So no matter what your age, your diagnosis, whatever, reducing inflammation in your body through your diet, through exercise, making sure your sleep is as good as it could be, whatever medication your physician is recommending for you, whatever supplements that you have been recommended to you to reduce inflammation, this can absolutely improve your brain health. Whether you have ADHD, whether or not you might have dementia or you're worried about it, reducing inflammation is going to help. I cannot stress that enough. We're really, really learning more about that. So now what? If you're worried about your memory, you should try and go see your doctor to make sure you don't have a treatable illness. I haven't mentioned this yet, but there are actually some pretty treatable medical conditions that can make us have poor memory, like a urinary tract infection, problems with your thyroid. So make sure you're healthy, and that's not the reason that your memory's not so good. Look at your lifestyle. If your lifestyle is staying up late and eating junk food, your memory might not be so great. So try to address those things that are in your control. That might help. If you're in perimenopause, consider educating yourself about your options. We're learning more and more about hormonal treatments, and the options that are available to women. There's many more options than we thought as our research base is growing. So speak with an informed provider and just figure out the potential risks and benefits of that for you and yourself, and that might help with your attention and memory. Let's say you do all this and you're still worried. Well, in that case, before you assume you have dementia, consider getting assessed for ADHD. If this diagnosis was raised at any point in your life, if it was ever mentioned in childhood, but say a teacher mentioned it, but your parents didn't want you to have medication as a child, or maybe say when you were younger, you had a bunch of friends with ADHD and you're really related to them, but you're like, I don't think I have it. If it was ever raised, or if you ever wondered, consider getting an assessment. Because there is a bias in healthcare against considering ADHD in older adults. That is why I'm doing this talk. I'm trying to change that. You may have been living with it all your life, and now it's causing you more problems, and it should be addressed and treated appropriately. If you already know you have ADHD, ask your doctor about trying stimulant medications. Maybe you've been living with ADHD, managing it, and as you get older and your life has changed, you've retired, and there's no more structure in your life that was helping you keep it together. Your life is more stressful, which, remember what I said, means fluctuation of symptoms. So now might be the time in your life actually where you want to try medication, and your doctor can help you figure out if there's any reasons that you shouldn't be doing it, the risks and benefits associated with it. So have that conversation if you already know you have ADHD. It's such a common condition in childhood and in adulthood and in older adulthood. So as our population ages, more and more adults are going to have problems related to ADHD. It stands to reason, right? So reach out there's ADHD support groups all over, and most of them are online now. There's lots of resources for you to learn about how to manage your challenges and how to improve your quality of life with ADHD. It is not a death sentence, but it is a chronic, treatable condition. There's medication options, like I said, but there's lots of non-medication options too, and it is never too late to learn to figure out how to treat ADHD if in fact that's what you're dealing with.
What kinds of questions should we be asking a psychologist, or I think preferably a neuropsychologist, but what kinds of questions should we be asking a person like yourself if we want an assessment for cognitive impairment, mild cognitive impairment is what you called it, or ADHD? Can you tell us a little bit about that?
Yeah. So that's a good question. So what I always tell adults is if they are wondering if they have ADHD and they weren't assessed as children, but they have some suspicions and they're not worried about cognitive impairment. Let's just start with regular adults for now.
Yeah.
They don't necessarily need to have the full meal deal assessment. And in a good interview with a very good history, which is one of the reasons we created the software, is it really helps people provide a good history in a way that doesn't cost them too much money. If someone has done that with you, so if you're seeing your physician, you've seen them multiple times, and if you're seeing a psychologist, they're doing a really in-depth interview with you, and you feel like they understand your story, that's enough. The psychologist or the physician should have enough to tell you if you have ADHD or not, or some other condition like an anxiety disorder, let's say. If you think you might have genuine memory impairment, so the way that I've talked about memory being the encoding problem or the retrieval problem. Memory is slightly different than attention in that attention has to get into memory. So attention is like the gate to memory. So if my attention feels like it's pretty good, but my memory feels poor. So, you might say to me, I can have a conversation, I can hold the conversation, I can read a page of information. But as soon as I look up from the book or I get distracted from the conversation, I have no idea what I just read or what we were talking about. That sounds like a memory impairment. And so, if that's the case, and you're thinking, maybe I also have ADHD, you still need the good history because we have to have that. My advice would be is if your family doctor says, I think you have ADHD, which they would be unlikely to do for an older adult, but let's say they did, and you try the medication, which is a stimulant, and they decide it's safe for you, and it really seems to help, and you feel like, oh, actually, I'm not as anxious, I'm not as forgetful. Maybe you have ADHD,
Okay.
or maybe you set up some systems. But if you try that and it doesn't help at all, and maybe it just gives you fast heart rate and you lose weight because you're not eating enough because it's a stimulant, well, then maybe you should look again. I mean, sometimes especially when it's mild cognitive impairment in a bright person who's really educated, it's subtle. If you have another symptom, like you've lost your sense of smell, that's concerning to me. People with ADHD do not lose their sense of smell, but people with Alzheimer's disease do. So
Ah,
these are the kinds of things. So maybe my advice is when you go see your physician or you go see a psychologist like me, you tell them everything, even if it seems weird.
I'm curious, when you're talking about having to sort of sort everything out here, I've also heard some people lately being diagnosed with ADHD and high functioning autism. Can you tell me a little bit of it? Because that doesn't make sense to me. Can you tell me a little bit about that?
Hmm. Actually, they're really commonly comorbid. High functioning autism, whatever we're going to call that. I mean, autism is on a spectrum now. We understand, we
Yes.
call it autism spectrum disorder. And so it can go from someone with low IQ, nonverbal, who's, gets overwhelmed very easily, but manages in a controlled environment with the right supports, to a person for whom their most prominent problem is they're a bit socially awkward. They don't quite know the rules of how to be, and they get a bit anxious because of that. So it is a huge spectrum. And in fact, in my practice, which is with adults, I see a number of adults who I think might be on the autism spectrum and they have ADHD. So I actually think they stay connected through the lifespan for these folks. And sometimes when they come to me, they've been misdiagnosed. So people who are on the autism spectrum but undiagnosed, they can seem quite dramatic. They can have very big emotional reactions. So
Yep.
while people with ADHD can have dysregulated emotions, it's more extreme than that. Like it's really intense and they can have big outbursts because they just need everything to stop. Sometimes they can be misdiagnosed as having a personality disorder because they're having such a hard time in their relationships. And that to me is such a disservice to those people because they do not get the right treatment. ADHD is an executive function problem. If organization, planning, those are the real issues for the adult. Sustained attention is not so much an issue. Getting out of your seat, not so much an issue as for adults. It's the disorganization and the people who feel like they're failing at being a grown up. And so that's where coaching comes in. A stimulant
Right.
can't fix that.
Uh, Can you tell us a little bit more about healthy lifestyles? You were mentioning earlier about neuroinflammation.
Yeah.
I mean, I hear this message, about healthy lifestyles all the time. I'm just wondering if you want to, expand on that just a tiny little bit.
So as a psychologist, not a physician or a dietitian, I can tell you what I've read. And I
Right.
do a lot of reading in this because I'm really interested in protecting my brain and aging as healthy as I can. So the um, and Netflix also has a bunch of shows on gut health, which I found quite interesting.
Hmm?
So I think the prevailing opinion now, and I've actually started assessing for people's sort of nutritional habits in my assessments so that I can give them feedback on this,
Yeah.
is a diet that looks somewhat like a Mediterranean diet. So
Gotcha.
lots of vegetables, lots of non-animal fats, olive oil, avocados, You can be vegetarian or vegan as well. Those are perfectly good options. The heavy processed food and the high meat diet seems to be associated with more inflammation. I raised this slide just to let people know that when I say get assessed, I have co-developed an assessment software platform, and so that's part of my work. You can go to that website and you can start your assessment. It won't necessarily be with me. We have a whole network of psychologists in BC and actually outside of BC who provide these assessments, pardon me, and they get the referrals through us. We're just trying to help connect clients with doctors.
Thank you again for another great presentation. Thank you so much, Claire. It's very much appreciated, and look forward to other Psychology Month talks. All you have to do is go to the psychologist.bc.ca, and there's a whole bunch of links there.